Alrighty, hello. This is our presentation all about syphilis. Our presenters are Jalen, Emma, Nevaeh, Hannah, Maya, and Makai.
My side of disease information, the disease is called syphilis. The medical name is treponema pallidum infection. The common name is syphilis. Etiology is the cause by bacterium treponema pallidum. Spread mainly through sexual contact or from mother to baby. The shape is a spiral shape. The gram stain is gram negative, but it stains poorly, and the type is bacterial infection.
Necessities for syphilis. Concerning the nutritional needs for syphilis, there's none because there are bacteria. The environment is really vital for ensuring syphilis spreads. If conditions are too dry, and if it's on surfaces outside of the body, it's less able to survive and spread. The environment of syphilis spreads on the body. It's typically in the areas of the genital, however, not exclusive. Because syphilis spreads through contact of syphilis sores, any exposed areas to the sores are vulnerable to syphilis. Populations disproportionately affected by syphilis are Black Americans, American Indians, and gay men.
Signs, symptoms, body systems, organs, bodily parts affected. The first symptom is a small sore called a canker. The sore often painless due to people not noticing they have it. It appears at the spot where the bacteria enter the body. It often forms about 3 weeks on average after you come in contact with syphilis, and it should heal in about 3 to 6 weeks. The second symptom would be a rash, usually right after the canker heals. It is often not itchy, may look red or reddish brown, and it may be so light and faint you may not see it. The rash often starts on the trunk of the body, which includes the chest, stomach area, pelvis, and back. It also appears on the limbs like the palm of hands and soles of feet. Along with the rashes, you may also start to see wart-like sores in the mouth, genital areas, hair loss, muscle aches, fever, sore throat, tiredness, fatigue, weight loss, and swollen lymph nodes.
Treatment, tests, and diagnosis. Syphilis can be treated using penicillin, other antibiotics, such as doxycycline, tetracycline, etc. Primary and secondary syphilis is treated with a single shot of penicillin, and in some cases, to the organs and tissues may be permanent. Two most common types of tests are RPR, a blood test that looks for an antibody your body makes recognizing a response to syphilis infection, and then BDRL. This test can be done on blood or spinal fluid, and it's for a more wider range of antibiotics that your immune system might make a response to a syphilis infection.
Vaccinations and complications if not treated. Choosing to not receive treatment as it progresses to the last stage, you are at risk for life-threatening complications. The damage to your body gets worse, which is why it's important to get the treatment as soon as possible. Left untreated can cause blindness, paralysis, which then leads to problems with your heart, brain, spinal cord, and other organs. Unfortunately, there are no approved vaccines for syphilis, but it can be treated with antibiotics that contain penicillin. You must finish all your antibiotics even after the sore or rash goes away. Make sure you contact anyone you've had sex with within the last 2 years and let them know to get tested. Your doctor will test your blood after the treatment to make sure the infection is gone, and it is possible to contract syphilis again even after the successful treatment, which places you at a higher risk for reinfection.
Prevention. The best way to avoid syphilis is to abstain from vaginal or anal sex, but since most people will have sex in their lifetimes, practicing safe sex is the next best option. Using barriers such as condoms, internal condoms, which are used for women, dental dams, latex, and/or natural gloves help protect both partners from transmitting or contracting this STD. It is also important to get tested regularly for STDs, especially if someone is having sex with multiple partners. Asking to see a partner's recent test results, such as through MyChart, which we use here on campus, to confirm they are free of STDs is another smart and proactive step in prevention. Finally, next step is to pay attention and know what syphilis may look like, as well as the symptoms. It is important when sexually active.